Good morning, everyone. My name is Matthew Middlebrooks, and I get the pleasure of working with a team that specifically focuses on voluntary benefits and the way that these programs really better support and enhance both broker strategies and employers. We recognize that we really have to understand who we're offering benefits to, and that's the best way we offer programs, right? Today, we have 4 different generations that are converging in the workforce, so that's really where we start. This is being driven heavily by millennials, now making up almost 40% of this workforce. And we know that brokers, consultants, and employers are really evaluating a number of different things. They're evaluating the different needs these groups have, the different programs that they want to offer to these different groups of people, how they communicate these programs, and really how this is driving the way they're designing their benefit strategies. Another important piece of this is also that we're continuing to see healthcare deductibles rise year over year, and we've talked some about that this morning. If we look out over just the past 3 years, we've seen an increase of almost 60% of the number of employees that now have a healthcare deductible that's over $1,000. This means that employees are continuing to see more and more first dollar responsibility, and the natural question becomes, are they prepared for this? Are they setting aside those excess dollars? Are they saving these monies for the unplanned or unexpected? And what we're finding is that a number of folks are not doing this or not prepared. In fact, 49% of individuals share they have less than $1,000 accessible to them to pay for unexpected medical expense or an injury. 53% of people would have to use a credit card or worse, dip into a 401k and incur penalties to pay for these types of expenses. And almost 70% of people say they generally would not be able to adapt to the cost of a major injury or illness. Sean shared with us earlier, we talk about this thing, the deductible gap. And what's also important about that is it's not always just the employee, right? Employees are insuring their dependents, their spouses, their families. And even when we see an employer and an employee contributing to an HSA, and we compare that to that average employer, family deductible, there still can be substantial cost that falls at the feet of the employee. We really see this pairing together with that data we've talked about as employees asking for help. They want access to programs that really help them insure these first dollar costs, create confidence for them for the unexpected. For the child on Saturday that maybe falls on the soccer field, breaks an arm, has to ride in an ambulance, goes to the emergency room for the first time. Or a spouse that do it all to fix her up that falls off the ladder cleaning the gutters on Saturday, breaks a collarbone, has to miss time away from work. And so our teams are dedicated on working with products that really help employees with these concerns, these first dollar costs. We also recognize that many employers today are already offering a number of voluntary products. Those can be more standard, like a short-term disability for the individual, kind of ensuring that unexpected time away from work. Or they can also be more specific towards like millennials, the new entrants to the workforce with student loan consolidation. Our community told us on the Benefitfocus platform last year that we had an increase of almost 88% for the sheer number of employers that are offering more than 3 voluntary products. We believe this is a testament to those employers understanding a number of the things we're talking about this morning and really wanting and commanding access for their employees to enroll in products like this, to ensure for the unexpected, the unplanned. We also recognize that we have to be prepared for that. And so we have the opportunity to work with 20 of the leading voluntary benefit providers in the marketplace today, offering over 40 different types of products on our platform. Things like critical illness and accident, things you're familiar with, but also student loan consolidation, 401k counseling and management, overall financial wellness programs. And we're not just creating the most robust voluntary benefits portfolio and working with these partners, we're also creating the most efficient and simplified way to enroll in these plans. And so today, for a plan like a critical illness or a disability or a 401k evaluation, we're able to enroll in those things just like we do with our medical, our dental, our vision. This creates confidence for employees, but also creates a scenario where an employer has more confidence in educating these programs, supporting their strategies throughout the year, and generally creating a more simplified way to enroll in products all in one place. These are just a few of the continual investments and dynamics that are driving those investments with how we enroll, administer, and offer products on the Benefitfocus platform.